There's a quiet little revolution happening in the world of mental health, except it's not so quiet anymore. More and more people are asking, are antidepressants, particularly SSRIs, really safe? And maybe more importantly, should we be taking them long-term for mild anxiety or depression? Let's get into it. SSRIs, or Selective Serotonin Reuptake Inhibitors, are one of the most commonly prescribed classes of antidepressants. They work by increasing levels of serotonin, a feel-good chemical in the brain, by blocking its reabsorption or reuptake into neurons. More serotonin hanging out in your brain means, in theory, a better mood. On paper, that sounds great. And to be fair, SSRIs can be life-changing for people with severe depression, major anxiety disorders, OCD, or PTSD. When someone's struggling to get out of bed or function at all, medication can make a critical difference. They're often part of a broader treatment plan that includes therapy, lifestyle changes, and support. But here's the part that's not talked about nearly enough. SSRIs are not magic pills, and they're not always the right tool for the job. They come with side effects, some of which can be more disruptive than the symptoms you were trying to treat in the first place. We're talking about things like weight gain, sexual dysfunction, emotional numbing, insomnia, fatigue, and sometimes even increased anxiety in the beginning. You know, the stuff that conveniently gets listed really fast at the end of a TV commercial. And while some people tolerate SSRIs well, others feel like they've swapped one problem for another. Let's also not ignore withdrawal, or, as it's more gently called, discontinuation syndrome. Even though SSRIs aren't technically addictive, stopping them abruptly can lead to brain zaps. Yes, that's the actual term. Dizziness, irritability, flu-like symptoms, and a whole lot of, "Why didn't someone warn me about this?" This discontinuation syndrome can be so unpleasant that it scares many people away from even attempting to stop the medication, trapping them in a cycle of long-term use whether they want to or not. So if the side effects can be that rough, why are SSRIs so widely prescribed? One big reason is that mental health care is stretched thin. It's often easier to get a prescription in a 15-minute visit than to find a therapist you can afford, who's accepting new patients and who doesn't have a 6-month wait list. That's not a criticism of doctors, it's a reality of the system. And because SSRIs are generally seen as safe, they've become a kind of default option, even for people with mild symptoms that might be better managed with therapy, social support, exercise, or improved sleep. Here's a bit of context. The original clinical trials that led to SSRIs being approved often focused on people with moderate to severe depression. But once on the market, prescribing expanded to include milder forms of depression and anxiety, sometimes without full consideration of whether medication was the best first step. Now here's where we hit the heart of the issue. SSRIs were never designed to be a lifelong fix. In most cases, they're intended as a short-term support system, a way to help lift the fog enough so someone can start making the deeper changes that actually heal the root cause. Think of SSRIs like crutches. If you've sprained your ankle, crutches help you move around until your ankle heals. But if you never address the underlying injury, or worse, if you stay on the crutches forever, you risk weakening the muscles that were supposed to get stronger. And yet many people stay on SSRIs for years, sometimes even decades, without re-evaluation. Not because they still need them, but because no one ever suggested trying to taper off. Or they tried once, had awful withdrawal symptoms and gave up. Or, most commonly, they're afraid of what might happen if they stop. That fear isn't irrational. Mental health is complex, and for some people, long-term medication is the best option. But for many others, especially those with mild to moderate symptoms, the better approach may be temporary use, combined with therapy and lifestyle changes that address the underlying stress, trauma, or imbalance. This is important. SSRIs are only meant to be temporary in many cases, not a chronic medication like blood pressure pills or diabetes meds. The goal is to provide a biochemical leg up while patients work on the emotional and psychological tools they need to thrive independently. Unfortunately, there's still a huge lack of communication about what SSRIs are really for and how long they're meant to be used. Let's not forget that the brain is highly adaptable. When you take a drug that alters your brain chemistry for months or years, your brain adjusts to that new normal. So when you stop the medication, your brain has to relearn how to function without it. That's why stopping SSRIs requires slow, carefully planned tapering, ideally under medical supervision. Now let's look at some non-drug tools that can be incredibly effective for mild to moderate depression. Therapy, especially cognitive behavioral therapy, CBT, has been shown to be just as effective as antidepressants for many people, and sometimes more so in the long run. Exercise isn't just good for your heart. It boosts serotonin, endorphins, dopamine, all those good mood chemicals naturally. Sleep, diet, and social connection are massive, underrated pieces of the puzzle. And then there's sunlight. Low vitamin D levels have been linked to depression, especially in winter months. One underrated factor is stress management. Chronic stress changes brain chemistry and can deepen depression and anxiety. Techniques like meditation, mindfulness, and breathing exercises aren't just trendy. They have measurable effects on brain health. Even just 10 minutes a day can create a meaningful shift in your emotional resilience. Also, let's talk about nutrition for a moment. Emerging research shows a strong connection between gut health and mental health, the so-called gut-brain axis. A healthy gut microbiome can positively influence neurotransmitter levels and mood regulation. So yes, what you eat actually can affect how you feel. A diet rich in fiber, fermented foods, omega-3 fatty acids, and micronutrients may help support mood stability over time. Of course, this doesn't mean just go for a jog and cheer up. That kind of advice is insulting and unhelpful. But the point is, there are multiple paths to healing, and they often work better in combination. If you're currently taking an SSRI and it's working for you, that's great. No shame in that. But it's also okay to ask questions. How long have you been on it? Do you still need it? Are there other tools you could use now that you're feeling more stable? Sometimes people outgrow their need for medication and just don't realize it because nobody ever brought it up. And if you're thinking about starting one, especially for mild depression or anxiety, ask your provider, are there alternatives I can try first? That's a completely valid, responsible question to ask. You're allowed to be cautious and curious at the same time. Remember, the goal of any treatment is not just to cover up symptoms, but to help you live a fulfilling, healthy life. Sometimes that means medication, sometimes therapy, sometimes lifestyle tweaks, and often a mix of all three. The key is to work with a provider who sees you as a whole person, not just a diagnosis. So are SSRIs bad? No, they're valuable tools, but they are not cure-alls, and they're not without risks. The decision to start, continue, or stop an SSRI should be made thoughtfully, collaboratively, and with full understanding of what to expect along the way. The more honest conversations we have about them, the more empowered people are to make informed decisions, not out of fear, but out of understanding. Knowledge is power, especially when it comes to your brain. Because at the end of the day, your brain deserves more than a blanket solution. It deserves a plan that fits you. If this helped you see antidepressants in a more nuanced light, go ahead and subscribe for more myth-busting, pharmacist-backed insights every Friday at 5 p.m. Mountain Standard Time. And hey, if there's a question you've always had about medications, health myths, or why your body does weird stuff when you least expect it, I'd love to hear from you. Drop it in the comments. This is Pharma-Logic, where medicine meets meaning, one smart, side-effect-aware video at a time.